I'm Garvin Lynch. Welcome to Lynch's Pharmacy Health video series. This video is on psoriasis. Psoriasis is a common skin condition which typically develops as patches of red scaly skin. The most common type by far is plaque psoriasis, which is where there are patches of red skin called plaques. Each plaque looks very red and with an overlying white, often silvery, flaky layer that will often feel quite rough. There's usually a very sharp and well-defined border between the edge of the plaque and normal skin. The most common affected areas are outside of the elbows and the kneecaps. Plaques can form anywhere, but don't usually form on the face. Psoriasis is caused by a build-up of skin cells. Skin cells are constantly dying and falling off, and new ones are replacing them. The problem with psoriasis is that this process happens too quickly, and so we get a build-up of skin cells. Plaque psoriasis can be itchy, but it usually doesn't cause too much discomfort. In terms of treating it, there's no real once and for all treatment for psoriasis. It's not unusual for people to try a couple of different products before they find the one that suits them. And one product that suits one patient often doesn't suit another. So it's very much an individualized treatment. Many of the treatments are ointments or creams, and it's a general rule that these have to be applied directly in a specific way for them to work, and often take several weeks to clear plaques. Not treating may be an option as well. If somebody has a couple of plaques and they aren't too bad and they're not in a noticeable area, they might choose not to use anything and can always change their mind down the road if it gets a little bit worse. For those who do want to treat though, the same emollients we see used in eczema are perfectly fine for psoriasis, as well as the likes of emulsifying ointment and aqueous cream, the Olatum range, Eucerin, Elave, Aveeno. They all do a full range of products like bath additives, lotions, moisturisers, and most of them do kids versions as well. The important thing with the emollients and moisturisers is to use them regularly. A psoriasis patient could easily go through one of these 500 gram tubes or tubs a week if their symptoms were bad. Use them after bathing because the way they work is they lock in the moisture, so the best time to use them is after a bath or after washing yourself. So that's the emollients and the moisturisers. Coal tar preparations have been used for a long time to treat psoriasis. It's not totally known how they work. It's thought they slow down the process of skin cells dying and being replaced by new ones, and also probably reducing inflammation. It's very useful when psoriasis spreads to the scalp and when you get plaques on the scalp. So some of the products are polytar shampoo, which contains coal tar, Capasol therapeutic shampoo, which contains coal tar and salicylic acid, and cocois ointment, which also contains coal tar and salicylic acid as well. All scalp treatments for psoriasis often contain a mixture of salicylic acid and coal tar, and maybe a steroid as well. They usually be on prescription. Steroid creams, which aren't on prescription, like the 1% hydrocortisone, can be very useful in psoriasis as well. The problem with them is that if they're used for too long, when you stop using them, then the psoriasis can actually rebound much worse than it was to begin with. So a couple of important points with steroid creams, no matter what you're using them for. They're generally only to be used for no more than 4 weeks before going to a doctor, and they're to be used sparingly. So how do we judge how much to use? We use something called the fingertip unit. A fingertip unit is the amount of cream you can fit on the tip of your index finger, and that is enough to treat an area the size of the back of your hand. So that's how you judge how much cream to use. So use them sparingly and use them only for a maximum of 4 weeks, and don't use them on the face, just on the body and the neck and behind the ears if needs be. So psoriasis for a patient will flare up and come and go for the rest of their lives. They're probably going to need a course of these treatments throughout their lives. But the important thing is to look after their skin when it's healthy as well as when it's bad. So the use of emollients and the moisturisers regularly to keep the skin hydrated. This will probably reduce the frequency of the flare-ups and hopefully the severity of them as well. And let the patient know that it's a very individualised treatment. They may have to try 1 or 2 products before they find the right one that works for them. Also bear in mind that a lot of these over-the-counter products can help people with psoriasis, but often psoriasis needs prescription products. So maybe if somebody has psoriasis, it's not being controlled, they need to see their doctor, because it is quite likely that they may need a prescribed product like a steroid to control it. If you have any questions, you can contact me through the live pharmacist on the website, or email me, or call into the pharmacy here in Broaddale and Douglas up Maryborough Hill. Thank you for watching.